welcome back. My name is Carly. I'm a technician here at St. Charles Veterinary Hospital, and I'm joined with Dr. Nanesian today to talk about types of veterinary care and what to look for when you are looking for a new veterinarian.
Don't forget, we're also joined by Sully.
And Sully back here, yes.
But this is a topic we come across a lot because we are both in ER and a general practice, and people often seem a little bit confused about the difference and the different offerings that are out there.
Absolutely. So when we're talking about types of veterinary care, what are the types of veterinary clinics available around us?
So there's a good little list going. So the first one everyone kind of thinks of is your standard general practice that you go to for vaccinations and routine care. There are also emergency hospitals, and that can vary from full 24-hour facilities to ones that are open nights and weekends only. There are also now some things that are being called veterinary urgent care, which is sort of in the same vein as human urgent care. They deal with minor emergencies per se, but not necessarily life-threatening things as much. There are then specialty hospitals where they have individual specialists, and those can be big specialty hospitals with multiple specialties under one roof, or that can be standalone ones where you have, say, a neurologist or a cardiologist. And then there's low-cost places, so things that specialize either in like low-cost comprehensive care, low-cost vaccines only, or even low-cost surgery like spay neuter.
Yeah. So what type of hospital is St. Charles Veterinary Hospital?
So at St. Charles, we are a 24/7 ER, but we are also a general practice. Now we keep those two services fairly separate. Of course, the ER is always available to our general practice clients, but those coming in through the ER do not necessarily have access to the same general practice services as our general practice clients.
So when it comes to choosing a veterinarian, what should I look for and what should I try to avoid?
So the big thing everyone does right now is Google them, right? But Google gives us so much information and it's a lot to wade through. A certification that I really like to send my own friends and family looking for is AHA certification. That just basically says that these hospitals adhere to a higher standard as far as what they're providing and the standards they set. You can read reviews, but take reviews with a grain of salt. Obviously there's a lot that goes into those, so read between the lines, so to speak, on that. And then look at the services they provide. Are they going to be able to offer you surgery under that same roof, or is that something you'd have to go elsewhere for, because not all hospitals offer surgery anymore? Do they see exotics? If you have exotic pets, is that something you're looking for? Do they offer other services you're interested in, maybe holistic things or things like that? So just be aware of what you're looking for. Oh, hours are another big one to look for. Some people need night or weekend hours. That's a big one. And what their emergency services are. Some places have an on-call service where you can talk to the vet team there, or some people just refer you straight out. If those things are important to you, make sure you're looking for that when you're vetting these places.
Absolutely. So now we'll get into a little bit about what to expect in certain veterinary visits. So say I'm bringing my puppy or kitten here, what should I expect to have conversation-wise?
So I think the most important things we go through, and this is part of the nice thing about there being multiple puppy and kitten visits, is we want to touch on vaccines and other preventative care, some of which is tailored to your pet and your lifestyle, so that's important to go over. So that includes like heartworm prevention, flea prevention. Does your pet need tick prevention? Are you in an area where that's not so important? Do you need lifestyle vaccines like Lyme and influenza? Are you talking about behaviors? Another big one. If you're running into issues with like house soiling or training, that your vet is the first resource for that. And then talking about like spay neuter. So when we time that, any additional procedures, for example, giant breed dogs, we will talk about gastropexy, brachycephalics like our Frenchies, we'll talk about airway surgery and things like that. That should all be started during your puppy visits. We should also be talking about breed-specific concerns, because we all know certain breeds or certain species have specific concerns. So those are things we want to go over from the beginning to make sure pet parents are really aware of what they need to watch for their pet.
Perfect. So what topics are usually discussed in just a routine visit?
So a routine visit is just a check-in. It's any minor concerns the owner might be worried about, checking their weight, making sure we're not going up, we're not going down. Dental health is a big one one we like to touch on. We try not to get too deep into any immediate medical issues. We want to like start talking about them during the visit, but we may have to schedule those out for a separate visit. Changes in lifestyle, because that can be important. If your lifestyle has changed, your preventative care may need to change as well. Mobility is another big one we touch on. As pets get older, we want to check in with that repeatedly. But like I said, any major medical issues or things that we think might need a larger workup, we're going to probably say, yep, we hear you. We definitely want to investigate this. Here's the next step, and let's schedule that appointment and get that going.
Absolutely. So moving to like senior pet visits, which we've covered in a previous video, what should be covered at a senior pet visit?
So definitely check in on weight, dental health, mobility are big ones. Supplements are another big one I like to talk on, as far as like, should we be adding fish oil, glucosamine, things like that. And always touching in on quality of life and what things we're looking at to make sure our senior pets are experiencing a good quality of life at all times.
Absolutely. So at St. Charles we do see exotics, so what should we expect in an exotic pet visit?
The biggest one, and the one that takes the most time, is actually the husbandry review. So the vast majority of problems we have with our exotic pets have to do with how we keep them in captivity. Is their enclosure appropriate? Is their UV light, their temperature, their diet appropriate? So it takes a lot of time to go through that, and it definitely is something that gets annoying to go through time after time after time, but it's really important that we go through it and make sure that we're catching any changes or issues in that early rather than later.
Absolutely. So how does my veterinarian tailor recommendations like spay and neuter, preventative care, lifestyle advice for my individual pet?
And again, so this is really where that like non-cookie cutter approach comes in. So we want to make sure that your vet is looking at your pet as an individual, hearing about your lifestyle. Do you travel to areas where Lyme is endemic? If so, you need the Lyme vaccine. Does your pet board or go to grooming a lot? If so, we want to talk about influenza vaccination because they're exposed to other pets. Do you hike with your pet? We may want to talk about tick control, all those types of things. And then the breed of your pet has a lot to do with it as well. So if your pet is a breed that is at risk for what's called GDV, we're going to talk about surgery like gastropexy and things like that. So it has to do with your lifestyle, breed, individual things, and just making sure overall that, again, your pet is not a number and is an individual.
And there are, of course, some things to watch out for when looking for new veterinarians. So what are some older medical practice that have kind of fallen out of favor?
So big ones are non-anesthetic dentals. There are plenty of studies out there that showing dentals need full anesthesia to be effective. Declaws are really, in most areas, becoming non-ethical for our pets. Certainly there are medical reasons, but that's becoming a thing. And then cosmetic procedures are becoming less and less. So it's not saying that those things are bad. It's just saying any practice who's offering you those things without a conversation is probably not doing their due diligence by you.
Absolutely. And we touched on this just a little bit, but for our last question, why is it important for veterinarians to discuss quality of life throughout all stages of a pet's life?
So when we live with a pet every day, quality of life can be something that's difficult to see if it is declining, and those little subtle changes over time can be easy to miss. So we always, our biggest goal is to make sure that your pet is living its happiest, healthiest life. And if there are small changes we can make to make sure that that is happening, we want to always be talking about that and always pointing those things out to you.
Absolutely. So that's it for questions. We do have a little bit of a game we'll play next, but did you have a story you wanted to share today?
Let's do the game.
We'll do the game first.